to get back into that clinical environment, get back to working with patients. That is what we came to medical school for. That is what we work so hard to study for. Without adequate PPE and protection, it would be dramatically difficult for someone to feel safe in a clinical environment, especially with COVID. In collaboration with ExxonMobil and Rowan University, we were able to have professional guidance through creating these masks. We first wanted to see how physicians were able to adapt them into their working environment. These masks allowed us to continue to be involved in patient care, clinical experiences.